Good morning, good afternoon, good evening, good whatever time of day it is. Thank you for tuning in to Conversation with Dr. Don. For your first-time viewers, Conversations with Dr. Don is an ongoing series of one-hour standalone talk shows where I interview interesting people like most of you out there about who they are as unique, one-of-a-kind individuals, and whatever it is we have decided to talk about. My guest this evening is Dr. Sam Metz. Again, he's been on a number of times in the past, and I love him. I love what he talks about. I love how he is as a human being. Thanks for coming on again.
Thank you very much, Don.
Yeah. How are you feeling right now?
I'm feeling great, and I always enjoy being on your show.
Thank you.
You never ask a dull question.
Oh, because of your answers. It just works very well every time. Did I say every enough?
You did.
I'm kind of nervous as usual, but you're not nervous?
Not yet. You haven't asked me a question yet.
As you know, the show goes in two major segments. The first segment is the Who Are You? Where I'll talk to Dr. Sam about who he is personally, so you get an idea where he's coming from when he talks about healthcare reform and other things. And the second half, or three-quarters, or whatever is left in the second half, we'll talk about the subject for the show, Healthcare for All, Oregon. And Dr. Sam has been at this for a number of years, and you've done heroic work through the years. And I've watched you through the years work hard, and it's paying off.
That's good to hear.
So let's start off with, we'll do an abbreviated version because people who see this show have seen you in other shows, so we won't do the whole in-depth bio, like who's your great-great-grandfather, for example. If I asked your best friend, who is Dr. Sam, what would he or she say? Sam is what? Be in the first person.
Oh, knee-jerk screwball advocate for healthcare reform, maybe? When I see my wife lip-syncing to my tirades, I know I've gone on a little too much. I've been doing healthcare reform for about 5 years. And the first introduction to it was really on your program, 2009, when the core of Mad as Hell Doctors, the four of us appeared on your show.
Yeah.
And out of that show grew the Mad as Hell Doctors.
What a memory.
You are part of our lineage.
Your work doesn't affect your memory. You're an anesthesiologist, aren't you?
I'm still an anesthesiologist, yes.
But you don't smell that stuff, do you?
I never sample what I give my patients, I assure you.
Okay, and when and where were you born? How should I call? Shall I call you Dr. Metz or Sam or what?
Only, I'm afraid, family and intimate friends call me Dr. Metz. You'll have to call me Sam. I was looking at the American flag,
oh, the American flag, yes,
on your intro. I was born in Washington, D.C.
Whoa, you saw a lot of flags there.
We moved when I was 2, so I don't remember seeing them, but my American heritage started at the very beginning. And I've been in medicine for 30 years. I've got a gray hair for every patient I've taken care of.
Yeah, you got a couple.
I'm also unusual in that most members of my specialty aren't too aggressive about healthcare reform.
Why is that?
It's interesting. Little diversion. The Gallup poll asked a sample of Americans whether they supported the Affordable Care Act. And it turns out you can pretty much guess what somebody thinks about the Affordable Care Act, not by their age or their income or whether they're insured or their state of health or whether they're employed, simply by their political party.
Really?
Yes. It turns out most people thinking about the Affordable Care Act doesn't reflect anything about health care. It reflects what they think about the legacy of President Barack Obama. Now,
wow.
Within medicine, you can guess what what a physician is going to respond to when you ask them the question, what sort of healthcare reform do you favor? By looking at their specialty in their income.
Hmm.
How does that work? Every bit of healthcare reform talks about we need to pay primary care physicians more. They're the frontline troops. They're the first physician. That's the entry that people get to our healthcare system, and there just aren't enough of them.
Okay.
So we need to bring more in, and we need to reward them for their work. We need to pay them more.
Yeah.
Well, where's that money going to come from? Well, the handwriting on the wall says it's going to come from the incomes of highly paid medical specialists, like anesthesiologists, dermatologists, gastroenterologists.
You're making too much money right now.
That's above the median.
All right.
So physicians, like anybody else, are not eager to embrace concepts that are going to reduce their income.
Okay.
Likewise, if we go to a universal healthcare system in Oregon where every physician is paid the same for their services, no matter who their patient is. Doesn't matter whether the patient has tattoos or pearls. I'm going to get paid. Well, now all of the payment begins to equalize out. So physicians who exclusively get private pay patients who will reimburse a lot get paid less. Physicians who take care of Medicare patients will get paid more. Physicians who take care of Medicaid patients are going to get paid a lot more. And patients who have to take care of, physicians who have to take care of patients for nothing are going to get paid a whole lot more. So you can look at a patient's subspecialty and look at their payer mix. How much are they being reimbursed for their services? And you can do the calculation and find out, will healthcare reform increase or decrease their income? And most people's morals, if I may be cynical, are usually in concert with their financial interests.
Uh-huh. Let's hold on to that and let's continue on with the bio stuff here, the details about who Sam is, okay? And anything worth reporting about your cultural heritage, or you're just plain old American white bread?
My grandparents are all Jewish immigrants.
Mm-hmm. I remember now, yeah.
Right, and my father's generation, my mother's generation were the first to get educated, and now my generation is benefiting from this theme of get yourself an education whether you want it or not, kid. So we're now enjoying the benefits of an immigrant community who are welcome to the U.S., even if they weren't welcomed, thrived in the U.S., and now we're giving back 2 generations later.
Yeah. Do you have brothers and sisters?
I have a younger brother. He's the smarter one.
That'll be the day. No.
And he too has got his advanced degree.
Uh-huh.
So we're still waving the flag, as it were.
Okay. All right. And wife, boyfriend, girlfriend, compatriot?
I'm married. I've got a 15-year-old daughter who's very busy being 15 years old.
15?
Yeah, she's going to turn out to be a wonderful woman and burn out all her parents in the process. So,
what is she going to do when she grows up? You know yet?
I don't know, and I just want her to grow up. What she does once she gets there, that's up to her.
Okay, all right. And how would you characterize your political persuasion? Are you left, right, center, or what? Are you a Tea Party or what?
Depends upon the perspective.
Mm-hmm. Generally speaking, across the board, if you can make that kind of a guesstimate, a judgment. I'm a screaming leftist, liberal, progressive.
I see. I'm a screaming moderate.
A screaming moderate.
I'm an intensely fundamentalist moderate. Although in today's climate, I'd probably be called progressive.
Why is it you always come up with some new term that throws me?
You just invite it, Don.
I love it. I love it. I love it. Yeah. How about memberships that my viewers would be interested in? You belong to medical associations and that kind of stuff?
I do, several professional organizations, none of which are yet invested in healthcare reform. The intriguing organizations to which I belong are Mad as Hell Doctors, born and reared and thriving right here in Oregon, and the much larger organization, Physicians for a National Health Program.
Yes.
PNHP.org is their website.
Yeah.
Probably the single best source of information about healthcare reform, no matter what you think the solution might be.
Okay. Yeah. Okay. Any persons from the past or alive today that you look up to or admire? Any names come to mind?
It's interesting you mention it. Yesterday, we just learned of the death of Arnold Broman, who was one of the titans of academic medicine, medical integrity, and healthcare reform. He was 91 years old. He was the editor of the New England Journal of Medicine and made it one of the most respected journals in the world. He became editor emeritus. He never stopped writing about how to make medicine better and about healthcare reform and making sure everybody got healthcare reform. He and his equally distinguished wife, Marcia Angel, came to Oregon 2 years ago and appeared on a panel that PNHP and Mad as Hell Doctors hosted. And we ran the two of them ragged. He was 89 years old, and we kept him and his wife moving from Corvallis to Portland. He was at fundraisers. He spoke 4 different places in Portland, had a fundraising dinner. He never stopped moving. It was a loss to hear about his death, and PNHP has created a memorial in his honor. PNHP.org.
So you admire him?
I do.
Yeah.
I hope that when I'm 89, I hope when I'm 80, I have as much fire as he had and you have, and I keep fighting the good fight and I never get discouraged.
Never. That makes it all worthwhile. Yeah. One more question before we take a break and get to the meat of this program. What's right with America? Just overall, top of your head. Name a couple of things
America's
that's
the land
right.
of opportunity.
Yeah.
If you follow a few basic rules, you can get so far in the United States that just aren't available in other countries. This is an extraordinary country. Our American Revolution was truly the first application of what it meant to create a representative government from out of nothing. We've survived for 250 years, and it's just amazing that we're still here, and we still are thriving, and we still have hopes.
Yeah, a bit of a trick question here. I think there are some people in America now who would question if what you said is really true for them.
You're right. This opportunity is not equal.
Okay.
To our credit, at least we feel bad about that.
Okay.
There aren't too many countries that have the kind of intense activists who see what's right and are working for it and occasionally achieve something of significance.
Yes.
We do right here in the United States.
Oh, yes. So you're telling me what's right with America now. I was going to ask you that question, but you're already getting into it. What's right with America? Tell me a couple more things that's right with our country.
We're one of the largest countries in the world that has some of the most extraordinary diversity of cultures and races and religions. The part that makes me appreciate the United States is getting into a cab. Because typically it's an immigrant from some other country who came here to work for his family or her family. And they know that if they work hard, they'll probably do much better for their family than they would anyplace else.
Of course. And we're so spoiled. We're born into it.
I take a lot for granted.
Yeah. All right. Let's take an early break here, Mr. Director, so that we can have more time to talk about healthcare and related things. Can we do that now, Mr. Director? Bello? Okay, we're back. Thanks for staying tuned. And for you viewers who missed the opening of the show, Conversations with Dr. Don that you're watching is an ongoing series of one-hour standalone talk shows where I interview interesting people like most of you out there about who they are as unique, one of a kind individuals and about whatever it is we've decided to talk about. And we're talking about healthcare tonight with my guest who's been on a number of times in the past, Dr. Sam Metz, who's a delight. He knows the subject very well, and he knows so much about a lot of related things, and he's fun to be with. So thanks again for coming on.
Thank you for that testimonial, Don.
So, do you want to start off, or shall I ask you some questions?
Let me start by saying
Sure.
a few basics.
Please do.
There are still prominent elected officials who say the U.S. has the best healthcare system in the world. You don't have to go very far to discover that's not true.
Not true.
The United States has the most expensive healthcare in the world. Our public health, basic building blocks of civilization, is the worst in the civilized world. And we're the only country that bankrupts and lets people die because they don't have money for healthcare. We are unique in the industrialized world. To find a system like that, you really have to go to Cambodia or Namibia. You have to go to a third world country to see the kinds of devastation that our dysfunctional healthcare system has wrought on the United States.
Can you speak up a little bit?
Happy to do so.
Okay.
Don't let anyone tell you that we're doing just fine and we just have to tweak it. We do
That's
not.
what I'm hearing.
The United States is head and shoulders below every other industrialized country. We're talking about maternal mortality. There are more than 30 other countries where a pregnant woman and her baby have a better chance of surviving the pregnancy.
That sounds crazy.
It
America,
is.
the richest country in the world?
And we spend the most on health care. And why aren't we getting it? Why aren't we getting the health care we pay for? Americans on average, the average American pays about $4,000 a year in health insurance premiums and out-of-pocket payments.
That's a lot of money.
It is. And that provides inadequate health care that could disappear as soon as you lose your job or change your job, or as soon as you get sick and can't keep up your premiums, for about 60% of the country. And we have to more than double that amount to get the same kind of inadequate coverage for the sicker 40%. For the amount we pay for $4,000 a year per person, the average industrialized country provides comprehensive health care to everybody. Why aren't we getting it?
To everybody?
Everybody.
Okay.
They don't discriminate against the sick by saying, because you're sick, you pay more and you get less. We're unique. We don't want to be unique like that. We aren't getting this because we're the only country that filters its healthcare dollars through the American private health insurance industry.
I thought health insurance was good.
Not if you get sick. Most of the personal bankruptcies in the United States were caused by health crises in families that had health insurance at the time the crisis began. You can still go broke paying deductibles, co-pays.
Most of the bankruptcies, did I hear you correctly?
Yes, 75% of the bankruptcies
Medical.
in the United States, medical debt. Most of those families, they started with an insurance policy and they leapt out of their plane without checking the color of their parachute. Health insurance is not health care.
There's a difference.
Ask 750,000 bankrupt families. Yes, 2010, there were 12,000 medical bankruptcies here in Oregon, affecting 35,000 people because they had the temerity to get the wrong, some member of their family got the wrong disease at the wrong time. And their health insurance policy just didn't last as long as their disease did. You don't have to. There's no guarantee that you'll get better before you run out of money with the co-pays, with the deductibles, with the conditions that aren't covered. And of course, if you lose your job and you don't have any money to pay the premiums, you're gone.
Well, isn't that part of the free enterprise system where people should be paying their way and paying for the services they get?
That certainly is a free enterprise concept, that you should get only as much health care as you can afford. Now, that really doesn't apply to certain kinds of civilized services. Should you only get the police protection that you can afford? Well, if you're in a third world country, that's true. You only get the police protection that you can afford to pay personally. What about clean drinking water? Should you only get the water that you can pay for? What about educating your kids? Should you only have kids get educated if you have enough money to pay for them? The United States, Americans pay on average the least amount of taxes of any industrialized country. We talk about the tax burden in the United States.
Mm-hmm.
You leave the United States and go any place that has any claim to being civilized or advanced, you'll pay more taxes. We have the lowest level of social services, schools, medical care, police protection, protection for seniors. We have the highest income disparity between the very poor and the very rich. We have the least amount of social mobility of any industrialized country. If you're in the middle class anywhere else in the industrialized world, you've got a better chance of seeing your children do much better than you. When I spoke at the beginning of the hour about the sequence of education and progress in the 2 generations that my family has been in the United States, that's not true anymore. It's not even true for native-born Americans. And we're paying the penalty. We're paying the penalty by having the world's most expensive healthcare system with the least value and the worst healthcare. As far as the free market is concerned, that's only right and correct. But as far as us as a civilized society, that's not right. It's not correct.
How did we get into this situation?
The history is interesting. It goes all the way back to World War II. It was a mixed blessing that we were one of the few countries in World War II that wasn't bombed or invaded.
Uh-huh.
Almost every other industrialized country at that time, Western Europe, Japan, had to start over in the middle of a horrific conflict.
Yes.
And it wasn't, how are we going to make money? It's, we've got a population that's sick. We need to take care of each other. And they all came up with answers. And for the most part, they're all different. But we never had that problem. And in fact, we generated a private health insurance system because of our wage freezes. Employers decided, we can't pay talented people more, we'll offer them better perks. We'll pay for their health insurance.
Uh-huh.
That hasn't changed. We are the only industrialized country in which our ability to get health care depends upon being employed. And depends now on who our employer is.
We're the only country.
That's right. Any other industrialized country, one way or another, you've got access to health care, and it doesn't depend upon how much money you have.
We're talking about a radical change to our existing healthcare system. You're going to divorce it from the health
Insurance industry.
insurance industry. It'll be healthcare. There's two different things.
Yes. Just to give you a notion of where our health insurance money goes if it's not providing health care. Out of every $5 that we pay as a health insurance premium, out of every $5, the insurance company keeps $1. That's called normal. 20% kept for administration. All right? Out of every $4 then that goes to me, the provider, we spend another $1 trying to collect from the insurance companies. Remember, this is an industry that denies 30% of all first claims.
30%.
Not because they're evil, but because that's the business model. That's a nearly 40% loss of dollars. That's $350 billion a year in the United States that we pay in insurance premiums that doesn't go to health care. It goes to administration. 40%. Now, in contrast, single-payer systems around the world and in the U.S., about 2%.
That's a radical difference.
It is a radical difference. And if we're going to expect to rejoin the civilized world and provide health care without doubling how much we spend on it, we're going to have to rethink how we pay for it. Another unhappy distinction is we're the only country in the industrialized world that first fragments the population into tiny little risk pools. How much I pay for health insurance depends upon where I live, how old I am, who my employer is, the size of my employer, size of my family, and that determines how much I pay for health care and what benefits I get. And then we have to recalculate it every time I get older, or my family size changes, or I change employer, or my employer changes insurance companies. All of this cover Oregon is part of a larger disease in which we spend billions trying to figure out who's going to pay for our health care. It doesn't go to health care.
Say a few words about Cover Oregon for our national viewers.
Okay. Cover Oregon is the Oregon manifestation of the website health insurance exchange mandated by the Affordable Care Act.
Obama's Affordable Care Act, Obamacare.
Yes, correct. The Affordable Care Act mandated that every state had to set up a private health insurance exchange and have a website that would enable people who needed to buy insurance to do their one-stop shopping. They visit a website, they enter all of this information and more, and they press a button, and they get all sorts of competitive bids. That was the dream. And then you choose.
Well, that's why they cost so much money for when the insurance company's involved, because they've got to pay these people who set up all these kinds of websites and do this kind of evaluation and work at saving money.
Do you know? Do you know how much money other countries pay to have websites calculate what risk pool they fit into? None. There's only one risk pool once you leave the United States and go to another industrialized country. Human beings. And the set of benefits doesn't change depending upon who you are or who your insurance is. Here's one set of benefits. Treatable conditions get treated. And in other countries, you're not limited to only the physicians that your insurance company will pay for. The network is every physician and hospital in the country.
And the populations in those countries are happy with their system compared to the populations in America are happy with the American system?
They provide better care to more people for less money. There are unhappy anecdotal stories from around the world. You can get bad care anywhere in the world.
Sure.
However, the United States is the only industrialized nation where you can get no care if you have no money. That's what makes us distinctive. That's what's driving our healthcare costs high. People don't get healthcare, they stagger into emergency rooms. And that's why our public health is so bad. People just can't, they're standing outside the hospital that offers some of the best healthcare in the world, and they're locked out of it because they don't have the right insurance policy, because they don't have any money. That's not the way it's supposed to be.
Some greedy people are not getting enough profits out of the system.
It's not the profits. For example, most of the large insurance companies in Oregon are not for profit. But it doesn't matter whether you're for profit or not for profit as an insurance company. The first rule of any business is you're not going to stay solvent spending more money than you take in.
Okay.
In private health insurance, what that means is you cannot stay solvent selling comprehensive policies at affordable prices to sick people. You can't do it. It doesn't matter whether you're for profit or not for profit.
Okay.
So the goal of every insurance company in the United States is first, avoid sick people. Second, if you possibly can, put all of the costs onto the patient, high deductible, high copay. Next, don't put any expensive hospitals in your network. And finally, delay or deny payments as long as possible. That's how American insurance companies compete. For profit, not for profit.
Okay.
It's a bad business model. And the Affordable Care Act enhances it and builds on it.
So it's not a great improvement.
The Affordable Care Act, let me say one good thing about the Affordable Care Act.
Just one?
Just one. There aren't many good things about it. It's the first time in American history that the U.S. Congress has said that the health care of every American is the concern of the U.S. government. The first time. They came up with a warped way to express that, unfortunately. The Affordable Care Act makes more healthy Americans critically dependent upon the private health insurance companies, and it makes it even more difficult for the sick and the poor to get access to the health care they
So
need.
it's worse now than it was before the Affordable Care Act came into being.
We had the most expensive health care with the worst results in the civilized world before the Affordable Care Act. Now, the Affordable Care Act will do many things, but here's what it won't do. It won't provide universal access. If it works perfectly, there are still going to be 30 million Americans with no access and another 10 to 30 million Americans who are underinsured and at risk for death or bankruptcy if they happen to get the wrong disease at the wrong time.
So this is a far cry from Medicare for all.
That's right. There's no mistaking for it. There are a lot of folk on all parts of the political spectrum who either embrace the Affordable Care Act or reject it because it's government-controlled universal health care. And it's neither. The government has less control over health care, and even fewer people are going to have access to it. It's not going to reduce costs. It was never designed to reduce costs. Government spending will go down, if it works perfectly, but the total cost of health care will go up by $100 billion a year.
How did this happen? Were the legislators asleep at the wheel or what?
It was a leadership failure. President Obama is already on record. He knows that single-payer health care puts everybody in one risk pool, treats them all the same, and pays for health care without private health insurance. That's what single-payer is. He knows that's the best way to go, and he said that. And he wanted Congress to create health care reform. He treated them like a bunch of high school seniors and saying, your project is design a healthcare system that works. Go to it. And look what we got. He should have treated Congress like a kindergarten and said, sit down, shut up, and this is what you're going to do. It's called Obamacare. He had no role in it other than to sign it.
So that's the misnomer.
Yes.
So then why did the legislators come up with this kind of a plan? And it's like subterfuge. And they presented it to the populace as a benefit, and it's Medicare for all. It isn't really.
It's 900,000 words. I mean, we're talking a couple volumes of the Encyclopedia Britannica. Which one of our 535 senators and representatives understood this incredibly complex act? They all had different visions of what they wanted it to do, and didn't do any of it.
Before we through this evening, are you going to give me a few words about what a simplified, simple, effective system would look like?
Yes. Let's take a break, and I'll tell you right now.
All right.
Imagine that, let's talk on a state level.
Sure.
Because it's unlikely that the next generation is going to see any federal action. But we could see it here in Oregon. Imagine if all Oregonians took all of the money that they currently pay in health insurance premiums and in out-of-pocket payments and put it into a common fund. We'll call it a single-payer fund. That single-payer fund is run by patients, taxpayers, hospitals and physicians, the people who either get health care or deliver health care.
Where are the insurance companies?
They've moved on to automobile insurance and other places where they can do some good.
And long-term health, it just boosted, never mind, it's another story.
Everybody contributes, and then everyone is entitled to health care. Everybody in Oregon. If you've got a name and a birth date, you're entitled to health care. The administrative savings, by bypassing the private health insurance industry and by allowing me as a physician just to bill one agency instead of dozens of insurance companies with dozens of benefits, the administrative savings is more than enough to pay for comprehensive health care for everyone.
Everybody.
We actually save money by doing this. If we try to provide more care to more people with private health insurance companies, we have to pay more money. There's no way around it. There's just no way to do it. If we leave them out of it, and we have a single payer system, we all pay in, we all get paid, we all get our health care paid for, we save money. Not only do we save money, but I know that my family is going to get the health care they need no matter what happens to me.
Yeah.
That's the vision. That's how this works.
How are we going to get that for the state of Oregon?
Well, first, how do we know that it works? We know that it works because every single payer system in the world and in the U.S. provides better care to more people for less money in every population in which it's tried. People think that single payer health care is an alien socialist concoction designed to erode American values. Single payer health care was created by an American capitalist, Henry Kaiser.
Yes, yes.
He had three ideas that he wanted to try out. His first idea was if he kept his employees healthy, they'd be more productive and he'd make more money.
Sure.
Second idea was if he kept his employees and their families healthy, he'd be able to attract and retain productive employees and he'd make more money. And the third idea was if he just paid for their health care directly without filtering it through an insurance company, his cost would go down and he'd make more money. He was right. He did all of those. He made more money. And the dream of every large corporation in the United States is to create their own private single-payer system. It's called self-funding. 90% of workers in the United States who work for large corporations now, at this very moment, get their health care through private single-payer funds. Not because it's a socialist alien idea, but because it's the only way to get better care to more people for less money. And America's businesses all know that. For the sick, for the healthy, single-payer health care provides better care to more people for less money. Now, how do we get that in Oregon? It's going to take people like you raising consciousness, thinking about this problem and what we need to do about it.
What about the legislators who do this kind of work and make those kinds of decisions? Are they going to go along with what's reasonable and what makes good common sense?
Your viewers have in their homes one of these. This is a weapon of mass destruction. You take one of these and you write a 3-sentence letter to your state legislators, your state representative and your state senator. You say, our healthcare system has failed me, my family, my company, my clients, my business, my friends. Second, I want universal health care in Oregon so I don't have to worry about my family.
What about the federal Obamacare? Can you overrule that if you've got a satisfactory system in Oregon?
First, we have to get the satisfactory system in Oregon. And the third point you want to make to your legislator is, I want you to create a satisfactory system here in Oregon. Sincerely, your voting constituent. Oh, P.S. If you want to be assured of my vote, tell me how you're going to do it. If Oregon creates its own single-payer system, it still has to battle the federal government because the Affordable Care Act has made it extraordinarily more difficult to create reasonable, universal, cost-effective health care. That's one of the unhappy side effects of the Affordable Care Act.
Even in states who want to go that way.
Vermont has taken is the first to venture down this path. Legally, it can't do anything until 2017. But already it's predicted that it will provide health care to everyone in the state, guaranteed, with better results, and spend less money. Now, what made the difference in Vermont?
Yes.
Well, first, it had a study. It had a study that looked at how are we going to pay for this. It had several very elaborate studies, so that legislators didn't have to imagine how we're going to do it. Legislator didn't say, well, my barber says that single payer won't work. They actually had legitimate data that made the comparison. California's legislature twice passed publicly funded universal care bills.
Schwarzenegger?
Correct. Vetoed it twice. In both cases, a state study of how do we pay for universal health care was absolutely critical. Oregon has that opportunity now. Last year's legislature passed HB 3260. To learn about that, go to www.oregonstudy.org. And it compares 4 different methods of paying for universal health care in Oregon. Now, Oregon's not that progressive, and the legislature didn't fund this study. So we citizens who are concerned need to make sure that this study gets the funding so it can be performed. That's why you should go to www.oregonstudy.org. That, your weapon of mass destruction, the legislature will get the word.
Are we going to be able to do it?
It's going to be fun finding out. It takes, you can't wait for the right time. American healthcare is only going to get worse. We need to act now.
There are a number of things troubling Americans nowadays. The possibility of what's going on in the Middle East getting worse, and climate change, and a few other things that I won't think about at the moment. But health care, universal health care, is it going to get enough priority and enough juice? And people are going to just say that's just another thing to be concerned about. We don't want to spend our energy just on health care. There's other things to fight for.
We're the ones. We, your viewers, are the ones who supply the energy. We're the ones who tell the legislators, you should be concerned about this because we're concerned about this. And if you're not concerned about this, we'll vote for somebody who is. That's how we get action. That's one of the beautiful parts about America. You know, imagine that your viewers, you write your letters, and you write them once a month. So your state legislator is getting 10 letters like this a week, every week, after week, after week. And some lobbyist comes in and says, I'd like to write you a check for $50,000 if you'll vote against health care reform. Mm-hmm. The legislator is going to say, I'm happy to take all the money you want to give me. But I can't convince my constituents that they should be happy with the miserable health care they have. $50 million isn't going to do that. So thank you for the money, but I want to get reelected. So I'm going to take care of my constituents. That's how we get things done.
What about the power of money?
Money doesn't do an elected official any good if they don't get elected.
But sometimes, not sometimes, oftentimes, the media will show information that's designed to convince people to vote against their best interest. Money out of the political process.
That's what this show is about. It's letting people know that they can't depend upon people with a vested interest in making money off of them know what's good for them. You just look at your family.
I'm just challenging you to bring it all out here in the open.
You know, there was an interesting race, primary race, that your viewers have probably heard about, Eric Cantor in Virginia.
Oh my gosh, that's
Here's
unbelievable.
The second most powerful man in the House of Representatives who has outspent his opponent 10-1, an incumbent.
Yeah.
And with a few key messages, he's gone. He's history.
And everybody's got their mouths hanging open. What happened? So it can be done, huh? In spite of the money.
We should be the next. And you know, when it comes right down to it, votes trump money.
I would like to see that happen. I'm sounding like some people who sound so pessimistic and so hopeless. Revolution. We got to change the government.
We just need to change the way the people who represent us think and act.
Yeah.
And I've been talking to a lot of legislators. They're smart, caring people, but they don't know how their constituents feel. They don't feel the same pain that people who are watching their families suffer feel. We need to share that.
Yeah.
We need to tell our legislators, our lives are in danger. You can save us. We want you to do it. And they'll listen. They won't listen if we don't speak.
Oh, for sure. How soon are we going to see results of what we're talking about now, where we have an Oregon statewide Medicare for all?
There's going to be a cascade effect.
Okay.
That is, right now, everybody feels like they're swimming against the tide.
Yeah.
Everything's against them.
Yeah.
But at some point, something's going to click and we're going to realize more people want it than don't. And we're going to realize that the businesses in Oregon want universal health care. And the labor unions want universal health care. And pretty much everybody you know wants universal health care. What they need to know is how to pay for it efficiently. That's what this study will answer.
Okay.
The idea of health care as a human right. Somebody's going to say, no, it isn't, and the conversation stops. There's a subtext there. Upton Sinclair mentioned when he was running for governor. He said, it's hard to make a person understand a concept if their income depends upon their not understanding it. If people think that universal health care means they're going to pay more money, they're not interested. Single payer is the one way to provide universal health care and save money.
That's the rub.
Right. Universal health care is not the goal. It's the tool to save money on health care and provide better care.
Do you think the insurance company is going to sit still for this? This is my last provocative question for you because I'm running out of challenges.
We have a very interesting health insurance industry in Oregon. First, we don't have one or two that dominate the market. We've got at least 7 major insurance companies in Oregon, none of which has more than 15% of the market. Not only that,
7?
Not only that, most of them are not-for-profit. A mild advantage. But much more importantly, 2 of the largest health insurance companies in Oregon, Providence and Kaiser, are also providers of health care.
Oh, yes.
That means if tomorrow the single-payer ferry comes along and goes, poof, we're single-payer, and all you health insurance companies are out of business, Kaiser and Providence just move everyone from the insurance wing of the building to the provider wing of the building, because now the number of patients that they're going to be see is going to double, and every one of them is going to pay. And it doesn't matter who they are, they're going to pay you the same. 2 of Oregon's largest insurance companies will do just fine in the single-payer market. And this isn't just gas. The CEO of Providence and the former CEO of Kaiser are both on record as saying single-payer is the most effective way of paying for health care. These are smart people. Most of the business people in Oregon think that single-payer is inevitable and desirable. It's inevitable because it's the only way to provide universal care and save money.
So Oregon is a state where it's probably easier to do what you're talking about than most of the other states in the Union.
We're ready to boil over. We've got the heat. We need just a few more flames lit. We'll take off.
I can't wait. Yeah.
The study is an important step. Vermont, California, both of them needed a state study to provide their legislators with the information and the confidence to take action. Now, there have been about 24 other state studies of how to finance universal health care, and nothing happened. So having a study doesn't guarantee that we're going to move towards single payer. But not having a study guarantees we'll do nothing. That study is the first critical step. We get that study and Oregon can never back down from it. It's on the record.
When are we going to get the study?
If we get it funded, and it's going to depend upon people supporting the study.
Yeah.
Probably take a year. If we're very fortunate, the study will be done here in Oregon. There are already some prestigious universities in Oregon that are very interested in doing this study. And when it's done, legislators can't turn their back on it.
So does that cover Oregon? No, that's something different.
Right. This is the OregonStudy.org.
OregonStudy.org.
HB 3260.
Okay.
Yeah. Cover Oregon is Oregon's version of the Affordable Care Act insurance exchange.
That's Kitzhaber's thing?
And he didn't have any choice. The Affordable Care Act meant that every state had to create an insurance exchange or join the federal exchange. We good-hearted Oregonians said, we can create an exchange and a website that'll work better than anything else, and it'll be the model for the nation, and we hired the wrong company.
We're running out of time. I want you to look right in the camera and tell the viewers what's important for them to know.
Take-home message. Write your congressman. Write your legislator. Write your senator. Healthcare in America, in Oregon, is a failure. You want universal care, and you want them to do it. Next, www.organstudy.org. Learn about the study. See what you can do for it. Get educated. Go to pnhp.org. Learn about healthcare reform. Then go back to your legislator and say you want to talk to them. Bring your sick kids with you. You're the ones who are going to make it happen.
Oh, that's great. All right, looks like it's almost time for us to stop. So I got a few PSAs I want to put up that I think are important for you to know about. And there's conversations like that. Okay, that's our first one, the broadcast schedule for the show, and the days and times and the channels that it's on. And the next PSA, public service announcement, is to watch my shows on the web. Google Don Bay on YouTube. There's hundreds of shows on there through the years. And the American Civil Liberties Union, to save our civil liberties, go to the ACLU website and learn about the ACLU so we can save our civil liberties that are in jeopardy now. And we got the End Corporate Personhood. Go to move2amend.org to see about amending the Constitution to say that corporations are not people and money is not speech. To learn more about humanists and humanism, go to the American Humanist Association website, learn about humanists and humanism, and I'm getting tired.
They were a great audience for healthcare reform.
Yeah.
I recommend the humanists.
Okay, thank you. The Alliance for Democracy, go to the national website. And there's the Portland chapter too. There's 2 websites that you can go to and learn about the Alliance for Democracy. That's a great organization. We're working for the betterment of our country. And the Populist Dialogues, my friend David Doak, that runs that show. That's how you can go there. And remember KFC? Yes, not Kentucky Fried Chicken, Dr. Don's KFC. Kind, friendly, and charitable. Be kind, be friendly, and be charitable to you too. And you too. And you too. And you too, Mr. Director. Thanks again for watching. Good night. Bye.